And it's my privilege now to introduce today's speaker, Dr. Tieraona, the recipient of this year's Donald A. Abrams Lectureship in Integrative Oncology. An internationally recognized healer, a physician, herbalist, educator of remarkable breadth and depth, Dr. Lodog is a powerful voice for bringing herbal medicine, nutrition, and lifestyle approaches into healthcare for everyone, combining ancient and indigenous wisdom, scientific rigor, and compassionate care. As a pioneer in the field, Dr. Lodog not only served as a founding member of the American Board of Integrative Medicine, she was also among the first cohort of physicians to be board certified in what was then a newly emerging field of integrative medicine. Her leadership extends to her tenure as director of the first interprofessional fellowship in integrative health and medicine, fellowship director for the University of Arizona's Center for Integrative Medicine that was founded by Dr. Andrew Weil, as well as a co-founder and guiding teacher from the New York Zen Center's Fellowship of Contemplative Medicine. She currently oversees the Fellowship of Integrative and Functional Medicine at the University of California, Irvine's Susan Samueli Integrative Health Institute. Dr. Lodog has inspired countless leaders, clinicians, and educators to practice with both evidence and heart. Her work embodies the spirit of the Abrams Lectureship, integrative, curious, and deeply human in its vision of healing. So I'll just note that after the presentation, we'll have a few minutes for a discussion, and please join me now for Dr. Lodog.
So good to be here with you, all those in the room and also those on Zoom. So they found this picture. Yes, we both looked a bit younger there. I think Don said we were 20. This was 21 years ago. Anyway, yeah. I don't look the same, but thank you. Our eyes are getting older too, Don. So better. Anyway. I would have flown anywhere to have done anything that had to do with Dr. Donald Abrams. It's very special to me, and to many of you, I assume as well. So, my daughter, as she was looking at this, she was peeking over my shoulder when I was making my slide deck for this talk, and she goes, "I thought you were going to go talk about tentacles, Mom, because I usually do." That's my thing. I love herbal medicine. If you want to know about ashwagandha, saffron, black cohosh, echinacea, golden seal, hibiscus, hawthorn, you just name it, we got it. But I actually, when I was talking to Shelley, I said I'd like to do something a little bit different, and I think it's also a reflection of how long I've been practicing. So, in 1977, I went to massage school. So it just kind of puts into perspective that this has been a journey. Some of you are like, I wasn't born then. Yeah. I was a midwife and I was an herbalist, and I wanted to do massage because I also felt like that would be very useful to do with pregnant women and for newborn babies. So this has been a journey for a long time. And I went to medical school when I was a little bit older because I actually saw the shortcomings of herbal medicine and massage therapy and midwifery. I saw where we were lacking. And so bringing these two different sort of ways of seeing the world together was very powerful. So when I was thinking of this, it was sort of like, how do we think about these evolving paradigms in medicine going forward? And I had to create my learning objectives, but I put at the bottom my own, right? I'm not sure CME like that or not, but these objectives invite us to look not only at what medicine measures, but what it means to heal. And I think this is a big part of my message today, is how do we begin to return the soul of medicine to what we do? And if Donald Abrams, who this lecture is named for, has talked about anything in cancer, it's about returning the soul to the care of patients who are living with and beyond cancer. So, I'm going to have a hard time saying, but I hope this mic is working. Maybe. Is this mic working?
Yes.
Okay, perfect. So, So much of what I see in primary care has been an example of what maybe this woman shared. I'm a teacher, I got 2 young kids. I'm tired, I've been tired for months, I don't have a lot of energy, I put on some weight, I don't sleep well. And I went to my doctor and they did a bunch of labs and he told me all of my labs were normal. He gave me some sort of scale to see if I was depressed, and it didn't really show I was depressed, but he went ahead and put me on a Effexor because he said it might take the edge off. I just went and saw him again after 3 months of being on my Effexor, and my labs are still good. My blood pressure is good. I've been 3 months on the medication. I told him I'm still tired. I still don't sleep well. I still don't have a lot of energy. But he told me I was tolerating the medication and to give it more time. Wow. That happens actually more than you think. Where we've done all the labs, we've done everything we could check. And we often end up telling people that they're depressed or anxious and that we have medication for them. I love Sir William Osler. I've got some of the original kind of, well, not original, but the texts that were some of the treatise of what he originally wrote. And I love that even back then, more than 100 years ago, the greatest mistake of modern medicine, so think about when he lived and what modern medicine was, okay? Is assuming that the removal of disease is the same as the restoration. That if we remove disease, somehow they're restored health. And he said that was our greatest mistake, and he said that more than 100 years ago. I mean, this was where we were, and because Eric Castle said the same thing. The cure is not necessarily to heal. Curing's great. Curing is great. If we can cure your cancer, that is great, right? So curing is a wonderful thing, but it is to assume that because somebody has been cured of something that they have ultimately been healed. And I think I would challenge that. Healing involves so much more than that. So much of it is witnessing. So much of it is relationship, and it's about bringing meaning to the experience. And, one of the things that's interesting to me is that clinicians, doesn't matter what kind of clinician you are, while many, many people move away from suffering, that's what they do. People don't show up. Like maybe cancer is contagious, so people don't come by as much. We hear this from patients all the time. But people who chose to go into healing made the conscious decision that they were going to lean into suffering. They're going to lean into the suffering. They're not going to turn away from it. That's powerful. It's a powerful thing, and it's why we're here. In that woman's case, we fixed what could be measured, but we did not heal what was essential. And I think this is so important. We measure things and we fix them, but oftentimes we miss what is essential to that person. What I would be curious with her is, tell me your story. Where are you from? What was it like where you grew up? Tell me about your losses. Tell me about your dreams. Tell me what gets you up in the morning. Tell me about your kids. Tell me who you are. That does not mean I give you a PHQ-9 and you're an 8 and you're mildly depressed, so you shouldn't even be on an antidepressant, because this happens all the time. But because I don't know what to do, because all your labs are normal and you don't have energy and you're tired. And for me, not having energy, what does that mean? What is low energy? When somebody says I don't have any energy, I'm like, what kind of energy? Physical energy, like getting up in the morning, you've got energy to do stuff. Is it mental energy? Do you feel tired? Is your mind tired? Is it low motivation? You don't have the energy to do things? Like, tell me what that means. How many times we just see people use that term low energy and we're just like, low energy, here, take caffeine. Here's some herbal supplement, an adaptogen that's stimulating, that'll help you. We're missing the boat. We're fixing what we can measure, but we're not healing what is essential. I want to start out by saying I love Western biomedicine. I love it. And all you gotta do is spend time in places where there's not much of it to realize just how powerful and precious it is. It's illuminated our ability to diagnose disease, to understand pathology. By using reductionist methods, we're able to control for variables. We're able to assess safety. We're able to, treat chronic disease, treat acute disease, surgeries. What we've been able to do with Western biomedicine is so powerful. I spend part of my time in Kenya every year. We have a home in Kenya. And I'll just tell you, when you get out into some of the rural areas where there is no Western medicine, you realize how important it is. So I want to just say, I'm a scientist. Well, no, I'm not. I'm not a scientist. That's not true. I'm not a scientist. I'm a healer. And there's a difference. I'm not a scientist. Yes, I publish papers and I understand how to read scientific papers, but I'm not a scientist. I'm a healer, and there's a difference there. And I'm intentional there with my words. But I wanted to just say that I think this is so important. It's what I realized was missing as an herbalist and a massage therapist and a midwife, was that there was a whole world of things that I didn't understand that I wanted to understand. So this is important, but it's a little bit narrow. And we have to be honest about that. We have to be honest about what we can measure, what we can understand, and where the limitations are. I had a good friend, Freddie Cronenberg, who was at Columbia University, and I remember she was doing a black cohosh study. That's a herb that was used a lot for menopause. So she needed 80 women for this study. We're on the phone one night chatting because we were good friends. She says, "Yeah, we're still recruiting." And I'm like, "You're still recruiting? You've been recruiting for months." And she goes, "Well, I know, but like the exclusion criteria, it's like everybody keeps coming in. They got all these things that are in our exclusion criteria." And I said, "Well, how many women have you seen?" She said, "Well, I don't know." At that point, they 1,100 people had come in. They were trying to get 80. By the time she was done, it was a little more than 1,900 women had originally wanted to come into the study for them to get their 80. I told her, I said, "The problem, Freddie, and what's so interesting and what we should write our paper about is the fact that every woman that's going to come into my office is one of the 1,900 people that didn't qualify for your study. And so when I look at what your clinical trial shows, how meaningful is it to all my women who may have breast cancer, or may have heart disease, or may have elevated liver function tests? How relevant is this study to the people that I see?" So there's a narrowness in here because we are designed for homogeneity. I mean, that's what we do, right? We want to control variables. It privileges things that have quantifiable endpoints. That's an important thing. But we don't do well. We're getting better. We're getting better. AI is helping in some ways for all of the things we think about AI. Some people do. But evolving individual multi-approach types of therapies and interventions are difficult to do in our standard randomized control trial methods. It is. And if we look at traditional healing systems, they were all individualized. So how do we begin to look at this? And the last thing I would just say, the reason that botanicals often can work within this model is because you can make it like a pharmaceutical, right? It's a pill, you can put it in a capsule, you can randomize, double-blind, and placebo-controlled trial it. So anything that's pharmacologically friended, like a drug trial, gets funded. It's really hard to fund whole systems of medicine and to evaluate them. We're getting better, but what gets studied is what gets funded. That's the bottom line. And so it's easier to get some things funded at the NIH, especially now, than at other times. It's just a question. Today, what I hear about healing is really interesting because now it's all genomics and omics, genetics, precision, longevity, hormones, peptides, all the things that are going to save our life. It's cutting edge. And yet, having been in this for a while, I'm still sort of sitting there going, wow, It's like we're just expanding, we're expanding this same model. Are we still fixing what can be measured, and are we getting at healing what is essential? If we were doing that, how come so many people are depressed, tired, fatigued? How come 50% of people are getting their information off TikTok? If clinicians were doing the best job and people were happy, why is everybody complaining about the system? You know, and I will be honest, $27,000 for a family of 4 to get health insurance. I'm like, girl, I'd ask for my money back, because what you're getting for $27,000 isn't that great, right? It is a fascinating time to be looking at what people are asking for and what we're delivering. What we deliver, we're all doing the best we can. I'm not saying that. I'm saying that, are we losing something? This whole landscape of healing by just going deeper and deeper and deeper only into science. For me, I think there's different questions that are asked. And when I speak of traditional healing systems, I'm talking about intact systems, traditional Chinese medicine, Ayurvedic medicine, Unani. I'm talking about systems that have been around for thousands of years, have been codified, have been based on observation and refined. They ask different questions. So I think this is important. When biomedicine asks what symptom, what pathology, what disease can we eliminate? Important question. But traditional systems say what harmony needs to be restored. Now, these are different questions. You're asking 2 different things. Yet, because we have said what is scientifically valid is by looking at things through this one lens, we don't ask these questions, and we also don't validate them within their paradigm, within what they exist within all on their own. So for me, I'm like, I think a lot of my patients are looking at this. They already got their statin. They've already got their antihypertensive. They're already on their metformin. They're already taking those things. Now what they're looking for on TikTok and on influencers and reading all these things is they're looking for this. How do I become more of who I was? How do I feel more whole? That is an interesting question. And it's one that I think, imagine a world in which we were both doing both. We were saying actively, we're going to help reduce pathology, reduce chronic disease, we're going to manage symptoms, and we're going to be looking at how do we restore this concept of wholeness and harmony. Healing was always about that. The word heal, actually, when we look at it, from its origins, to restore to wholeness. That's what it means. We're going to restore you to wholeness. Ayurveda, when I was in India last year, was fascinating, spending time in an Ayurvedic hospital in New Delhi. And I'm there, and there's the OBGYN, and there's labor and delivery, and over here was pediatrics, and over here was cardiology. It was a hospital. It was a hospital, a huge hospital that was treating so many people. You're seeing the lines outside of people waiting to be seen. And when I was in there talking to these physicians, these Ayurvedic doctors, I was just taken away by the breadth of their training and understanding of disease. It's an ancient system, old. And talking about how they view things. So when somebody is not well, what is shifted in their diet? What's shifted in their constitution? What's shifted in the way they move through the world? They publish. They have an Ayurvedic journal. I'm meeting with these doctors. They're publishing their data. We don't look at that data because a lot of it's case control. A lot of it's N of 1. Doesn't fit with what we think of as scientifically valid. And yet the people that come there are treated and made whole. I couldn't believe the hospital when I was there. It was just amazing. Traditional Chinese medicine, pattern differentiation. They use the whole systems. So, it's like, I love people that, I love acupuncture. I have a lot of doctor friends who went and did like the Helms course and did acupuncture so that they can help it in their practice. I love that. Imagine, you're able to have your doctor be able to use some points and be able to help you. That's fantastic. Who do I go to? I go to somebody who's been 4 years trained. I want somebody who went through the whole system of acupuncture and did an additional year of herbal medicine. I want somebody with 4 years of training for myself, because pattern differentiation, looking at how it looks within context, within the system itself, matters to me. And I've actually found it's incredibly beneficial. So this is this whole systems thinking. And then, of course, indigenous, it doesn't matter where you're from. If we're talking about indigenous in Australia, we're talking about the Maasai people in Western Kenya, we're talking about indigenous people here in the United States. While there's great sort of subtle variation between them, depending upon where they live, there is a worldview. There is a view that basically harmony needs to be restored. Harmony needs to be restored. The Navajo, I live in New Mexico, the Navajo have an incredible diagnostic system. So you might think, well, oral, Navajo people, the Dene people. But if you go there, you go to the diagnostician, the stargazer, the hand tripper, and you go and they diagnose you. And once they've made the diagnosis, they send you to one of their numerous categories of healers, of specialists. I went years ago, I have epilepsy. I went years ago, I wanted to see somebody about it. So I go and I see the hand trembler and they do all this. And then they say to me, "Where's your mother?" I'm like, "What? Where's your mother?" I'm like, "Mississippi." They said, "Well, you need to bring your mother back." And then he just basically like left. Like out in the middle of the desert in Arizona. And I'm like, "What just happened?" And then I called my mom. She goes, "I don't want to go out in the middle of the desert with you someplace." Like, why? And I'm like, "Well, because I want to get some help." And they said they have to see you. She'd already thought that had happened. But so there we are, fly my mother out, drive out in the middle of nowhere, north of Tuba City, and that we're up there. And he doesn't hardly speak to me. He talks to my mother about her pregnancy with me. What she'd seen when she was pregnant, the emotion she went through when she was pregnant. My mother was, I saw this, I didn't even know she was diagnosed with thyroid cancer when she was pregnant with me. I mean, I never even knew this. Like, I'm looking at her like, "What?" You kind of left that out? He's talking to her about all of this, and then he says to me who I was going to go see, the healer that I was going to go see and do ceremony with. It was a powerful experience. And some people may look at that and go, "What would it matter what your mother was going through in pregnancy?" Because we have our own way of looking at what matters and what counts, instead of looking through different worldviews, how they diagnose things and how they bring things back into harmony through ceremony, ritual, etc. This concept of wholeness, though, is very powerful. So we know that there are a lot of strengths to these traditional healing systems, especially the large ones that I just spoke about. Much of it is around adaptability, resilience, coherence, restoration of imbalance, nourishment for the mind, the body, the spirit. So the Adler mentioned this when she was talking about Dr. Abrams' work. Strengthen connections and belongings through story, through community. I mean, this is part of our cultural lineage and our cultural wisdom that we have. Integrating rituals, seasonal rhythms, lived experiences, relationship, harmony, all of these things can be found in any of these traditional systems. They're asking a different question. Biomedicine is, what symptom pathology do I need to eliminate or at least manage? Traditional medicine is asking, what needs to be restored? They're different questions. And we need to stop trying to make all of the traditional systems fit within this Western biomedical model. It's the problem. They're not asking the same questions, but we want to use the same method to bring them together. I think for me, complementary and alternative medicine is what it used to be called all the time, CAM. some of us were around when it was the Office of Complementary and Alternative Medicine, and alternative medicine. But for me, why is everybody doing yoga? Why is everybody going to acupuncture? Why are people taking herbal medicines? I mean, this is why. We've got the other part down. When worldviews collide. I think that this is where the tension is most visible to me, is when we're saying a system of medicine must be forced into a model for which you lose the context, you lose the diagnosis, you lose everything that sort of made it what it was. And then you say, you know, you're not valid. I mean, it's like, you're not valid if you can't fit within that. You know, I remember Don Warren, he's a Lakota man and a Lakota physician. And I remember somebody saying once we were at a meeting and somebody was saying about bringing more Western medicine and getting more Western medicine onto the res. And Dr. Warren was trying to explain some of the position. And then one of the men in the audience who was a Navajo man stood up and just said, you know, you need to prove that your medicine is as good as ours. You need to prove that to us because we know our medicine works. Everybody just stopped because nobody believed that the Navajo medicine would certainly be valuable, valid, or as good, or why would Western medicine have to prove themselves to these people? What I'm saying to you is there's something that's not good when you only have one lens by which you judge truth. And it's not to say that we don't want to use the scientific method. That is not what I'm saying. I'm saying that you must begin to expand how you think of evidence and expand how we're thinking about how we're going to collect it. The question is not whether biomedicine is wrong. It is it complete? It's not wrong. Is it complete? No. My opinion, it is not. I think it's possible for us to bridge these worlds. Oops, sorry, I just skipped past one. Quick finger. I'm going to get to some of the research in a moment, but I just also wanted to say, when I said I was not a scientist, and actually I have to say there are very good physician scientists. There's very good physician scientists, but there's a whole lot of clinicians that are not scientists, and they wouldn't call themselves that, even if they feel like somehow it diminishes them not to. Science is wonderful. It can explain general truths really, really well. We heal individual lives. Right? So let's just be clear. One is looking for general truth. Controlled, objective, reproducible. It's not good science if we can't do that. It needs to be controlled. It needs to be reproducible. You know, I don't want to give you a prescription drug for something if we can't relatively be certain of its safety, its reproducibility, and that it works, right? But medicine is often context, it's contextual, it's relational, it's personal, right? We use these things, but this is not. I think that often we lose track of the fact that there is science, and I use science to help me practice the art of medicine. I use it to help me practice the art of medicine. I do not worship at the altar of evidence-based medicine. I refuse to do that. Because so much of what I've seen is like, you know, woman coming in, she's there for hormones, she's peptides, I want longevity medicine. New Mexico's big now for movie producers because they're making movies now. Netflix has got a big place there. I see this woman, very wealthy, there with her director person, comes out to my ranch because if you want to see me now, you come out to my ranch. They're like, you want me to come where? I'm like, yeah, it's a long dirt road at the end. I'll have a cup of tea for you. She came out, we did all this stuff, right? She wanted all these tests, she wanted everything done, we got all these tests. She came back a couple weeks later in a better vehicle for my road. And we're sitting, she's sitting in my study. I made her some tea. She was there for all of her results. I noticed something. When I was looking at her chart, she she had had 2 children, but she only mentioned one. G2PT, she had a child, 2 children. So I remember, I was just saying, I noticed that you'd had 2 children. And I only heard you mention one. And I didn't say anything. She doesn't say anything. I just sat. She said, I lost my other child. I said, I'm so sorry. And I don't say anything. This is where I think most clinicians make their mistake, is they want to fill in the space. They want to fill it in because people are not comfortable with silence. And you must become comfortable with silence, because that's where you give people the spaciousness to be able to say what they're feeling. Sitting there, she said, I just don't want to talk about it. I said, we don't have to talk about anything you don't. And I just sat there. Her son had been killed by a drunk driver just a couple of years before, and had burned alive while they were trying to get him out of the car. First responder. The weight that she had when she shared this, and then it was the shaking. So sad for your family. I can't imagine. I cannot imagine the pain. And she kind of started to, shrug a little bit. And I said, do you feel like there's still some healing that needs to happen there? And she looked at me, I don't know. And I said, I wonder if this moment is the right time for hormones and peptides. And I'm wondering if that's what would be most useful for you right now. I don't know. She didn't want all of those things. And actually, I sent her to somebody who does ceremony in New Mexico. A curandera who does a lot of ceremony for susto, for grief, for recapturing parts of our lost soul. She was very open to it. She wanted it. It was very powerful. We could fix what could be measured, but we needed to heal what was essential. This is what I mean about making space for story, for patients to talk to us, and for us to say contextual, relational, personal, focusing on the purpose, not the disease. Values precision, yes, but we also have to value wisdom and compassion. Healing is so much more than what we try to narrow it down to. We can bridge these worlds by evaluating things within their own paradigms. And you all are much better researchers than I'll ever be, but mixed methods research and at one design, so many of these things we would be able to do. And we could use this as also looking at honoring lived experience. Lived experience matters. This is just an example. Everybody wanted to start studying acupuncture. I remember this back long ago when I was on NCAM back then, and everybody's doing acupuncture research, and some of them showed really good stuff, some didn't, but we were using sham acupuncture, right? I'm going to use the real points, and over here we're going to put fake points in, right? Like somehow that, like what is that? And we would get all these kind of interesting results. But what's interesting to me is that acupuncture, let's take 2 examples of women with PMS. I have one woman with PMS. It's PMS. That's the diagnostic criteria. She meets it, but her presentation is, I get angry, I'm really irritable, I have heavy periods, I kind of clot the first couple of days, I have a sense of fullness, tightness in my chest. Okay, liver chi stagnation, right? So we would look more like that, right? So the river is dammed, how do we open the flow? The other woman comes in, she has PMS, same diagnosis, but this woman has light, scanty periods. She's kind of pale. She feels like, her PMS is more depressed, more sadness. Blood deficiency. I mean, we're looking at her like the river is running really low. We have to replenish the water so things move. And it's like we would say they're both PMS, and here's the points you would use, and here's the herbs you would use, because it's PMS. And what I would say is, why study acupuncture if you're going to do it like that? That's not its context. These two women, we have a diagnosis of PMS, but they do not both have the same diagnosis in the system from which it comes from. So if we're going to be intellectually honest and we're going to be scientifically curious, we need to begin to find out, how do we begin to test things using the paradigm, the diagnosis, the context from which it is developed. So this is, and we're beginning to see this, we're beginning to evaluate acupuncture within its own framework. And that will be curious to see where we land with it. Making space for not only do the lab values improve, but did the person feel more whole? This is relevant cancer research, where we're doing a lot more of this, right? So if we're looking at cancer centers and UCSF, even UNM, where I'm at, in my state, acupuncture, Reiki, massage, meditation, doing more things to help support. But now we're not only looking at biomarkers and tumors and what's happening here, but we're also saying, what about patient-reported outcomes? Fatigue, well-being, a sense of control, resilience. You know, when we begin to say, let's have a bigger set of questions that get not only at what matters maybe to the clinician, but what also matters to the patient. So we're seeing this being done more. We're creating a new evidence hierarchy where vitality and connection matters alongside survival. Lives restored to coherence. I really just want to find a way to put that picture up there. So I just thought it was so beautiful. My last couple slides. You know, when I think of the soft outcomes, I hear a lot, and they're considered soft. Joy, connection, resilience, purpose. These are like the soft outcomes. Are they really soft? I mean, those are healing outcomes, and they're human outcomes. It's so important for us to begin to start thinking, this person, this woman who's a mother with 2 kids, who's tired, fatigued, you know, low energy, who's now been on an SSRI or an SNRI for 3 months and still has everything, the same was there. Where's all of this? Yeah. We think that which is measured is far superior to anything that we could experience. And I think that we have got to say, this is not a choice between this or that, but it's both and. We need all of these things when we're looking at our research. Quantitative components, yeah, get the inflammatory markers, get this high sensitivity C-reactive protein, look at diurnal cortisol measures, what are a pain score, sleep quality, but then maybe down here, have you interviewed them? Did they have a moment of transformation? Did they have a moment of healing? Do they feel like they've been returned to wholeness? What about the practitioner narrative? I realized when I went to medical school and was doing my residency that so much of what made me effective as a midwife and what made me effective as like a massage therapist, what made me effective was that I was a powerful part of the healing. And I got why they want to randomize and double blind it, because I could affect the outcome of the study. Hallelujah. Hallelujah. We should all be affecting the outcomes of our patient interactions. It is something when you sit with somebody and they feel seen and they feel heard. How many times, and I know this has happened for you, have you been with somebody in the office, you've listened deeply, and when they walk out, you've not done anything. You've not ordered your lab, you've not given them a drug, you've not done any of that. And they say, Doc, I feel better. I feel better. Why? Because of the interaction that just happened. Now, I know we need to take that out and randomize controlled trials. I know all that. I got all that. But you see, I don't practice in double-blind or placebo-controlled trials. I practice in an office with a patient. You cannot take away that piece. For me, I also think this is really important if we're doing traditional systems. If you're working with somebody who's doing acupuncture, if we're doing a study using an herb that comes out of the system of Ayurveda, what about doshas? What about their energetic perspectives? How does that influence what they're doing with the patient? Ethnographic observations, rituals, pulse diagnosis, tongue diagnosis, community healing, especially in some of our more indigenous communities. All of this begins to give us a much broader picture of how we can begin to measure and understand what it means to heal. He was kind of a smart fellow. He was a smart fellow. Not everything that can be counted counts, and not everything that counts can be counted. Usually I do this exercise with residents. I love to do it with residents. I love to do it with medical students. I like to have them sit, put their feet on the ground. And I ask them to take a few slow, deep breaths. Then I ask them to close their eyes. I ask them to think about a time when they experienced healing. Not symptom relief, but healing. I ask them just to be with that for a moment. Like, where were they? Who were they with? What did they feel? How did it feel to have that moment feeling whole? I ask them, was it driven by a lab value? Was it driven by something you could measure? Or did it happen in some unusual place? Did it happen in a walk? Did it happen by seeing something new, a place you've never been, reading poetry, listening to some music, talking with someone? I want the medical students to remember that we've all been sick and we've all been healed. And to remember what it feels like in that moment of healing. What does it feel like? Relationship, connection, meaning, ritual. I'm an integrative medicine practitioner. It's what I do. And integrative medicine seeks in many ways to weave together the best of what we've learned with the best of what we've forgotten. It's not here to romanticize the past, and it's not here to say that biomedicine is wrong or to elevate it to a place beyond where it actually naturally fits. You need science, but you also need story. People don't feel connected. I can sit there and I can tell somebody, well, there have been 7 randomized controlled trials on rhodiola rosea for, fatigue, mental fatigue, physical fatigue, and I think that this might help you. Or I could say, it seems like you've been really tired lately, and I feel like you need, I don't know, like some Viking kind of medicine. Get that Viking medicine going. Then they usually look at you and I'm like, there's an herb called rhodiola that goes way up north. And I said, and for instance, the Vikings did use it. They used to take it on long journeys because it kept them from getting sick. It helped protect them from the cold. It made them more clear in their minds. I don't know. I'm feeling that for you. Does that sound like anything that, I don't know, maybe you'd like to try? Which one of those 2 versions do you think people remember when they leave? There were 7 randomized controls. Or you want to be a Viking, right? I mean, so it's about story. It's one of the things I love about plants, by the way, is because they're filled with stories, right? They're filled with them. Knowledge and wisdom. knowledge isn't that great without wisdom, and wisdom is fairly meaningless if there's not knowledge behind it. I mean, you need both skill and presence. I want the brilliance of modern research. I do. I want our researchers to keep figuring out ways to ease suffering on this planet. I want to find ways to take care and tackle some of the hardest things that people live with today. I want the data to be clear. I want it to be understandable. I want it to be in diverse populations. I want it to represent what the real world represents. I want safety. Because it's hard. Traditional systems, you gave somebody herbs, how would you know if there was some long-term chronic safety issues? They were harder to define. It's harder to know. This is where we can excel with safety. We can excel in this kind of way that this evidence provides. But we want this. We don't want to replace biomedicine. We don't want to romanticize the past. We just want to take the best of what we've done, the best of what we've forgotten. So as you continue your work as clinicians, or healers, educators, researchers, guides, whatever that is that you are, I have an invitation. Don't abandon your science. Don't abandon science. But please don't abandon the soul of healing also. Don't forget it. Bring your knowledge, bring your training, bring your presence, your humanity, your knowing, your cultural memory, your intuition, your heart. Be the clinician that can interpret somebody's labs while also holding their hand. Be the clinician who can interpret biomarkers, but ask how somebody's nurturing their dreams. Let us practice a medicine that's wise enough to measure what we can and humble enough to honor what we can't. Let's build a system where people don't come in and say, I'm tired, I have no energy, they told me my labs are fine, I don't feel fine. To a medicine where they say, I feel seen, I feel heard, hopefully I feel whole. This is the medicine our world is asking for and the medicine that we can create. And it is the medicine that can heal our patients, our communities, and ourselves. I want a bigger tent. I want a bigger tent. When I was young and I was raised a Methodist, converted to Catholicism, then was Buddhist. I went home and I told my grandma, I said, I'm really interested in Buddhism. And I just want to know, are you okay with that? She was a Sunday school teacher. She was a simple woman. Are you okay with it? Do you know what she said to me? She said, honey, all I ask is that you make your world bigger, not small. You don't have to forget everything you've ever learned or ever believed to make room for something else. Just make your world bigger. I think that's what I'd like from this, is to make our science, our medicine, our healing for our people bigger. And I think integrative medicine is one of the ways in which we can do it.